Alcohol, Drug of Choice Through the Ages, presented by Dr. Michelle Boltz in partial fulfillment of Nurse 673. Alcohol consumption has been an integral part of human culture for millennia, spanning various civilizations and historical periods. However, alongside its long-standing social and ritualistic significance, alcohol abuse has been a persistent challenge throughout history. Despite ongoing efforts to address alcohol abuse through education, public health campaigns, and treatment programs, the problem persists in many societies worldwide. Alcohol continues to be a leading risk factor for global disease burden and remains associated with various health and social issues. Alcohol abuse is characterized by a pattern of problematic drinking behavior that can manifest through various signs and symptoms. Common signs of alcohol abuse include the inability to control alcohol consumption, continued use despite negative consequences, neglect of responsibilities and obligations, and persistent cravings for alcohol. Other symptoms may include frequent episodes of intoxication, withdrawal symptoms when not drinking, tolerance development, and a gradual shift in priorities towards alcohol consumption at the expense of other interests or relationships. Furthermore, individuals struggling with alcohol abuse may experience mood swings, depression, anxiety, and cognitive impairment. Understanding its history can provide valuable insights into the challenges we face today and help shape effective strategies to address this public health concern. The consumption of fermented beverages dates back to ancient civilizations such as the Sumerians in Mesopotamia around 3500 BCE. These early societies recognized both the benefits and risks associated with alcohol consumption. Some references point to the Sumerians' use of beer in rituals and daily life, while also highlighting instances of alcohol-related excess and intoxication. Alcohol consumption continued to be a significant aspect of society through the Middle Ages. However, alcohol abuse became a growing concern, with various laws and regulations aimed at controlling its negative effects. In England, for instance, the Alehouse Act of 1552 attempted to address the issue of excess drinking and its consequences. The 19th and 20th centuries witnessed the rise of the temperance movement, which advocated for moderation or abstinence from alcohol. Concerns over alcohol abuse's social and health impact led to the prohibition of alcohol in several countries, such as the United States, from 1920 to 1933. The temperance movement's efforts were rooted in the desire to combat alcohol-related problems and promote sobriety. In the 20th century, scientific research into alcohol's effects on health and society expanded significantly. Studies began to explore the physiological, psychological, and societal consequences of alcohol abuse, leading to a better understanding of alcohol use disorders. Organizations like the World Health Organization and the National Institute on Alcohol Abuse and Alcoholism contributed valuable insights into the prevalence and impact of alcohol abuse. According to the National Survey on Drug Use and Health, approximately 85.6% of adults aged 18 or older reported past year alcohol use, with 55% reporting alcohol use in 2020. Alcohol use disorder, AUD, remains a prevalent concern, affecting an estimated 14.1 million adults in the U.S., as reported by the National Institute on Alcohol Abuse and Alcoholism. Moreover, alcohol-related harms have been linked to various health consequences, with the CDC attributing an estimated 95,000 deaths annually to alcohol-related causes, making it the leading preventable cause of mortality. Risk factors for alcohol abuse include genetic predisposition, early age of alcohol initiation, family history of alcohol use disorder, comorbid mental health disorders, and easy access to alcohol. Additionally, socioeconomic disparities, such as low income and limited education, contribute to a higher risk of alcohol use. Vulnerable populations, including adolescents and young adults, individuals with a history of trauma, Veterans and those facing social isolation are particularly at risk. In the short term, excessive alcohol consumption can lead to impaired judgment, slurred speech, motor coordination difficulties, and an increased risk of accidents and injuries. Acute alcohol intoxication may also result in alcohol poisoning, which can be life-threatening. In the long term, chronic alcohol abuse can lead to serious health issues such as liver disease like cirrhosis, cardiovascular problems, neurological impairments, and an increased risk of various cancers. Additionally, prolonged alcohol misuse can lead to alcohol use disorder, AUD, a chronic relapsing brain disorder characterized by an inability to control alcohol consumption despite adverse consequences. Socially, alcohol abuse can strain relationships, lead to work or academic problems, and contribute to legal issues. Understanding the short-term and long-term consequences of alcohol abuse is essential for raising awareness and promoting interventions to mitigate its harmful effects on individuals and society. Signs and symptoms of alcohol use disorder on assessment can include slurred speech, as alcohol can affect the central nervous system, leading to slow or slurred speech. Unsteady gait. Alcohol impairs motor coordination, resulting in an unsteady or stumbling walk. Red or bloodshot eyes. Alcohol consumption can cause blood vessels in the eyes to dilate, leading to red or bloodshot eyes. Flushed skin. Increased blood flow due to alcohol can cause the skin to appear flushed or redden. Odor of alcohol. A distinct smell of alcohol in the breath may be evident in individuals who have been drinking. Nausea and vomiting. Excessive alcohol intake can irritate the stomach lining, leading to feelings of nausea and, in some cases, vomiting. Impaired reflexes. Alcohol can slow down reflexes, affecting response times and coordination. Sweating. Alcohol consumption can lead to increased perspiration. Hand tremors. Some individuals may experience hand tremors or the shakes after heavy or prolonged alcohol use. Tachycardia. Alcohol can temporarily increase heart rate and blood pressure. An alcohol overdose, also known as alcohol poisoning, occurs when the individual consumes a dangerously high amount of alcohol in a short period, leading to life-threatening consequences. This can result in a range of severe symptoms, including confusion, stupor, vomiting, seizures, slowed breathing, and even unconsciousness. Furthermore, alcohol use is commonly associated with suicide attempts and contemplations. Numerous studies have highlighted the link between alcohol use disorders and suicidal behavior, with alcohol misuse increasing the risk of suicidal ideation and suicide attempts. The disinhibiting effects of alcohol may lower inhibitions and contribute to impulsive decisions, making individuals more susceptible to self-harm and suicidal behaviors. One of the most commonly used medications for treating AUD is naltrexone, an opioid antagonist that reduces the rewarding effects of alcohol and helps individuals maintain abstinence. Acamprosate, another FDA-approved medication, acts on the brain's glutamate system, helping to stabilize the brain's chemical balance during early abstinence and reducing the desire to drink. Additionally, disulfiram, an aversion therapy medication, causes unpleasant reactions when alcohol is consumed, discouraging individuals from drinking. Pharmacological interventions are often the most effective when used in conjunction with psychosocial therapies, providing a comprehensive approach to treating alcohol use disorders and improving patient outcomes. Cognitive behavioral therapy is a widely used approach that helps individuals identify and modify dysfunctional thought patterns and behaviors related to alcohol use. Motivational interviewing is another effective technique that fosters intrinsic motivation to change by exploring and resolving ambivalence about alcohol use. Additionally, family therapy can help address familial dynamics and support systems, as family involvement is crucial in the recovery process. Alcohol use disorder is a chronic and relapsing brain disorder characterized by an inability to control alcohol consumption despite adverse consequences. It can have severe physical, psychological, and social impacts on your health and well-being. If you or someone you know is struggling with AUD, it is essential to seek professional help. Evidence-based treatments such as CBT and MI and pharmacological interventions have proven effective in managing AUD and promoting long-term recovery. Additionally, support from family and support groups can significantly improve treatment outcomes. Remember, recovery is a journey, and seeking help is the first step toward a healthier and more fulfilling life. Alcoholics Anonymous is a widely recognized and accessible mutual support group that has been utilized for decades as a non-professional approach to treat alcohol use disorder. AA operates on a 12-step program emphasizing personal accountability, self-help, and fellowship to support individuals in achieving and maintaining sobriety. Although empirical research on AA's effectiveness is challenging due to its anonymous and non-professional nature, some studies have suggested positive outcomes for participants who actively engage in the program. AA provides a sense of community, peer support, and a structured framework for addressing alcohol dependence. It has been shown to reduce feelings of isolation, promote coping strategies, and improve overall well-being for individuals with AUD. AA can be particularly beneficial as a complementary treatment alongside evidence-based therapies and pharmacological interventions to create a comprehensive approach to alcohol use disorder management. Chronic and excessive alcohol consumption can lead to various GI complications, including liver disease, gastritis, pancreatitis, and esophageal disorders. A referral to a gastroenterologist who specializes in diagnosing and treating conditions related to the digestive system can provide a comprehensive evaluation of the damage caused by alcohol abuse. By collaborating with a gastroenterologist, we aim to ensure a thorough assessment of GI health and develop a well-rounded treatment plan to support your journey towards recovering from AUD while addressing any existing digestive issues. Follow-up appointments allow us to monitor progress, assess the effectiveness of the treatment plan, and make any necessary adjustments to optimize recovery outcomes. Regular follow-up visits also provide an opportunity to address any challenges or concerns that you may encounter during your recovery process and offer ongoing support and guidance. Additionally, it is essential to maintain open communication with the healthcare team, including addiction specialists and counselors, to ensure a coordinated and comprehensive approach to managing AUD. Research has shown that regular follow-up care, along with evidence-based treatments and support, significantly improve long-term recovery outcomes. By actively participating in follow-up appointments and staying engaged in a treatment plan, we can work together to promote your continued success in overcoming AUD and enhancing overall health and well-being. In conclusion, alcohol use disorder is a chronic and relapsing brain disorder characterized by an inability to control alcohol consumption despite adverse consequences. It encompasses a range of problematic drinking behaviors from mild to severe and can have severe physical, psychological, and social impacts on individuals' health and well-being. AUD affects millions of people worldwide and is associated with increased morbidity and mortality. Treatment options for AUD include both pharmacological interventions and evidence-based psychosocial therapies. Combining these approaches with support from family support groups and regular follow-up care can significantly improve long-term recovery outcomes. A comprehensive and individualized approach to AUD management is essential for addressing the significant public health concern and helping individuals achieve and maintain sobriety.